Welcome to the Chad G. Ortho OT Podcast. I'm your host, Chad Guerrero. I'm an orthopedic occupational therapist, strength and conditioning coach, sports trainer, and I hold over 40 specialty certifications in manual therapy, orthopedics, and sports medicine. On this podcast, we will discuss everything orthopedic therapy, sports medicine, and more. If you're a therapist, health and fitness professional, or someone just wanting to learn more about the orthopedic and sports medicine world, then this is a podcast for you. Let's get started. Hey everyone, welcome to the episode of the Chad G. Ortho OT Podcast. I'm your host, Chad Guerrero, and today we're going to talk about cervical neck and thoracic or middle back pain, middle upper back pain related to muscle endurance issues and muscle weakness. And so this podcast is not really about discussing things like herniated disc, protruding disc, compression fractures, stenosis, spurs, all those types of things. That'll be a different episode. But this is just really about some research that I found, which there's tons of research, but two research articles in particular that really looked at neck endurance and weakness as far as causing neck and back pain. And, I know a lot of us, we get like this, we're looking at computer screens, we're all looking down at phones or tablets or whatever at some point. And, our neck gets tight and between our shoulder blades gets tight and feels like it needs to be rubbed out or pushed on or things like that. And, we're basically developing these like tender areas or trigger points or whatever you want to call them, hypersensitive areas within the muscle tissue that needs to be kind of rubbed on and worked out or relaxed or desensitized or whatever you want to call it. And then, like in the neck or even in the back, it feels like it needs to pop. If it popped, it would feel better. Kind of why does that happen? And does that really work to pop it? Or are you going to truly have a big, change? And so, for me, I changed the way that I do a lot of things, over the last 18 years as far as my practice. Initially, I thought manual therapy was going to be the cure to a lot of orthopedic issues related to pain, or known as passive care with manual therapy. And that's things like massage and joint mobilization or manipulation. That's moving the joints or popping the joints, whatever you want to call it. I don't call it popping the joints for my scope of practice. We just call it joint mobilizations. But sometimes it pops, and all the popping is it's a compression of gas, that happens, the release of that gas, and within the joint space. And so anyway, or whether it's you're doing scraping techniques, or whether you're doing myofascial cupping or myofascial release or dry needling or whatever it is you're doing. That was my thought process was that's got to be that's the cure all there, and that's going to really make a big difference. And come to find out, not so much. Not saying I didn't get results, but results could have been better if I would have approached this as I do now. And now I do a combination of both. I mean, probably, the manual therapy and all that's of course included in our treatments with a lot of our patients, but it's not the be all. And looking at the research, and two of these research articles that were published, one was published in the Brazilian Journal of Physical Therapy, and then the other was in the Journal of Allied Health Sciences and Practice. And both of them really looked at like neck endurance testing and, basically how long can you hold the head and neck and the upper back in certain positions. And what they found was there was a high correlation with people that did not score very good on these tests, on neck endurance flexor test, which I talked about in my cervicogenic podcast in the first episode, neck extensor endurance, and then like thoracic spine extensor endurance. And so, there was a high correlation of people that could not get close in that normative data range that they were having pain, and just non-specific neck and back pain, upper back pain. And it also was more common in females in most of the studies that I looked at, more common than females and males. And something else that one study it was interesting. It said it was more common in females that were either separated, widowed, or divorced, and that smoked, and that had two or more comorbidity diseases. Now, those diseases, it didn't specify what they were. It could have been osteoporosis or osteoarthritis or degenerative disc disease, didn't say, but that did increase the chances of having just non-specific neck and or upper back pain. And a lot of us have, like I said, you've got some tension there. You're going to go get a massage, or go to your therapist or your osteopath or chiropractor, whoever they're going to do. If they do passive things, they just kind of rub you down and put you on an electrical stem or stab you with a handful of needles or whatever they're doing, and it's going to cure things. It may make you feel better temporarily, but if you notice, a lot of those people have to keep going back to those providers because it just does not get better, or it doesn't stay better, I guess you should say. So maybe it's reduced as far as the intensity, but it doesn't stay better. And I think if you just, these providers, practitioners would look at the neck strength and the neck endurance, how long the muscles can sustain the workload in a certain position, you would find that that's going to be weak on a lot of people, and that's something that needs to be included in your treatment plan. Now, that's not saying that okay, Chad, we've got poor posture and we're all leaning forwards, and so that's bad. We're all hunching forwards. Now, that's pretty true for a lot of people. Our posture is not the best, right, in most cases. But if you're looking at research, what is really good posture and what is bad posture, right, or poor posture? And I don't really know the answer to that, except I know that based off of research and education that I've had, and people that have mentored me and I follow, you change the stress, the mechanical stress on the body when you change positions, right? So, we're not made to have our heads forward and our backs hunched over all the time. At the same time, we're also not made for our backs to be just as straight as a board and our head and neck pulled back, in a perfect position all the time. We need variability with our movement. And that's something that I push a lot is having variability, just going all the way from that extension into flexion and rotation and side bending, and whether that's the neck, whether that's the arm, the elbow, whatever that is, we need to have and maintain full range of motion at all the joints so that our brain does not become accustomed to, Chad doesn't move his shoulder past 100 degrees. So when Chad moves his shoulder to 110 degrees, this is not normal and I don't like it. And so I'm going to send a pain signal, or I'm going to start muscle spasming, these types of things to happen. So same thing can apply to any part of the body. We have to keep that calibration going, right? And so that's just having that variability of movement, in all planes. And the thing is, if you have, let's say you go into a provider and they do manual therapy techniques on you, right? So they massage you and they use the scraping tools and they mobilize or pop your joints or whatever you want to call it. And the thing about it is those are all things really that are almost like preparatory to where you do those things and then you have the patient move. Whether that's they go through exercises or they go through certain movements or certain postures and positioning that should be followed up with that, because that's how you really keep and recalibrate this new range of motion. We're doing these passive things to desensitize tissue so that you're able to tolerate more movement. And it doesn't have to be just exercise, whether it's just functional task training where you simulate work task, or you simulate stepping over in and out of the tub, and we could be as basic activity of daily living or as advanced as a professional athlete needing to perform something as you want to be. But you need to follow that up with some sort of movement that really complements and optimizes the range of motion that you got. Otherwise, guess what? You're going to be back in the same provider's office 2 or 3 times this week for the rest of your natural life. Now, there are people with certain conditions. I understand that, maybe surgery is the only option. And those folks opt. They don't want to have surgery. So what are they going to do? So they come to therapy for almost like a maintenance type programs. They get relief and it helps them to move, but doesn't cure them, but it keeps them from having surgery. So I get that. And that's a different situation. So, I understand that. But the biggest thing is like I said, checking the neck flexor endurance and strength. Okay, that's on the front side of our neck. Neck extensor endurance and strength. It's on the back side. And then thoracic spine extension, which you can't really isolate just thoracic spine. I mean, when you're checking this, you're kind of doing thoracic spine / lumbar, but obviously the focus is on thoracic spine, and you want to check the endurance in that. Now, you can go online and you can Google or YouTube or whatever, cervical mobility exercises, cervical strengthening, cervical endurance exercises, thoracic mobility, thoracic strengthening, thoracic endurance, and find a whole host of things that you want to do. As a matter of fact, I think I have some stuff, I know I have some stuff on some of my social media posted about all that as well. Now, the disclaimer on this is make sure before you undergo any sort of medical treatment that you get cleared by your primary care provider, your therapist, whatever kind of healthcare provider you use, because this podcast does not replace in-person medical advice. It's for entertainment purposes only. So, you can even go on and I'll put the link in the description of this podcast, but I have a website for the Chad G. Ortho T podcast, kind of like a little social media hub. It's not a big fancy website, but it's a place you can go to, and you can click on links to all of my LinkedIn, Twitter, Instagram, my Facebook pages, all that stuff. Down at the bottom, you can subscribe to my mailing list. I am going to start sending out just some informational stuff on email. So if you want to subscribe to that, you can. And then there's also a form at the very bottom of the page that you can fill out if you have questions. So you can fill that out, any questions about anything musculoskeletal wise, therapy, rehab, sports medicine, and then I'll get back with you. And also my business website, it's been built basically for almost 2 years ago, about a year and a half ago. I just not have finished a few things that needs to go into that. So a friend of mine actually built it for me, and it'll be much nicer than my one that I'm putting in the description here. But this one's just an easy way to find all of my stuff. So if you want to go and check that out, any of that stuff, videos, you can. Anyway. Well, I hope that helps, guys. And again, that basically is to let you know that passive things where you just lie there on a matter table and have done to you, although they feel good, in most cases, it's not going to fix your issue if your issue is related to muscle endurance or strength of the cervical or thoracic spine. Again, this does not include disc issues, stenosis where we have narrowing, fractures, etc. So I hope that helps, guys. Thank you so very much for all the support. I'm so grateful. I'm very thankful and impressed with how many views or listeners that I've gotten on my podcasts. Man, it's just really crazy. I don't know if I could listen to me I think this one's going to be about 12 or 13 minutes. I don't know if I could listen to me talk for 12 or 13 minutes. So I do appreciate you so much. And if you would, please rate me 5 stars wherever you listen to this podcast. It would definitely help me out. And you guys have an awesome day. Thanks so much. This podcast is brought to you by Guerrero Rehabilitation, setting the bar for rehabilitative and sports medicine care.